Hi, my name is Diana Robertson. I'm in Ohio State University Hospital today because I'm having a tumor removed from the pituitary region of my brain.
Diana came to Ohio State for the expertise of a team of surgeons who treat rare and complicated tumors called skull-based tumors.
If you could grab a skull and look at it, it's the underside of the skull. So basically, it has is what joins the cranium to your face and what joins the head to the spine.
I had headaches all the time. It's been going on for 10 years. At times it gets worse, it gets excruciating.
For patients like Diana, tumors growing in the skull base region can lead to blindness and hearing loss, debilitating headaches, memory loss, and in some cases can be fatal. Doctors Ricardo Carrau, an otolaryngologist, head and neck surgeon, and Daniel Prevedello, a neurosurgeon, have combined their talents to offer skull-based surgery to patients like Diana. They are among the few surgeons in the world who pioneered a minimally invasive endoscopic technique. That means rather than making large incisions to access the tumor, they can remove it through Diana's nasal passageways.
We offer high-level, high-complexity skull-based surgery using minimally invasive approaches like endoscopic endonasal surgery and also very complex open approaches.
I'm really confident with them. I have all the faith and trust in the world in the doctors and the people here at OSU.
Diana's procedure is very unique because we performed this surgery using her own nostrils and air passages. We went through her nose with a camera that allow us to visualize with high definition these structures located around the skull base and near the base of the skull and brain. So by using the nasal passages with the camera, without any other incision in her face, we were able to remove the entire tumor for her without causing problems.
Over the decade that Drs. Prevedello and Carrau have been performing skull-based surgeries together, they have also evolved how the surgeries are performed and have even created and patented specialized surgical instruments that are necessary for their complex and delicate surgery.
The main challenge we have with, in general, minimally invasive surgery is the lack of space. So you're trying to do the same type of surgery that originally was performed with large openings where you can see and you have freedom of movement. Now you're trying to go through a small corridor, difficult, the freedom of movement is not there, it's difficult to move your hands, and we have created several instruments to allow us to go through these small corridors and perform resection of tumors.
Drs. Carrau and Prevedello aren't satisfied with being nationwide leaders in skull-based procedures. They're also making sure surgeons across the country and the world can become trained to perform this surgery.
So our idea is to train the next generation, right? So when I look at what I do, that's going to be my legacy. So what do I leave behind? It's not the papers, it's not the surgeries that I have done, it's not the idea. It's really that people that will continue taking care of patients, that will continue evolving the field and making progress in all these aspects.
While they're training new surgeons, Dr. Carrau and Prevedello continue treating patients like Diana Robertson. Her skull-based surgery was a success, and she felt an almost immediate change.
It's been good. I have no more headaches. Before I was irritated a lot because my head always hurt. I'm not irritated a lot anymore. I'm not grumpy anymore. So I spend more time with my grandkids having fun. And I've been down here multiple times for different things. But everybody here in every field I've been down here for, they've been amazing.